right, welcome back to Open Line, everyone. I'm Rhori Johnston. Our guest tonight, Dr. Stephen Patrick, the director of Vanderbilt Center for Child Health Policy, and we are kind of breaking down their latest poll, the Vanderbilt Child Health Poll. This is the third one, right, Doctor? Third or fourth? Third, right? And, you know, really interesting to see what Tennessee parents are saying, the concerns they have for their kids. And we mentioned in our first segment, education and school quality right off the bat. That's kind of broad, though. Let's dive into that a little more. Do you get answers or look for answers that are just a little more than that? Give us specifics.
Yeah, in some cases we do. Okay. And so next week we're going to dive into learning loss and school loss. We know, for example, during the early parts of the pandemic, of course, many schools shut down, and even in the fall last year, there was a fair amount of kids who missed class, either for quarantining or being sick. So that's really part of the issue. And we know in the last couple of years, during the pandemic, we had kind of record learning loss for Tennessee kids. And so as pediatricians, one of our goals is to make sure we keep kids in school and we do the right things to keep them in school too.
And let me ask you this, kind of get this out of the way. How frustrating has it been to be a medical doctor, a pediatric specialist, and also an experienced researcher? So you know that it's all about getting information. And the more information we have, the more we learn, and that kind of guides how we react to whether it's COVID or whatever else. To sit there and watch this play out in such a kind of a politically divisive way that it has, that's got to be frustrating.
It's pretty disheartening.
Yeah. Because I will say that I think that's a stressor for kids as well. Just knowing, whether, should I wear a mask to school? Should I not? Should I say this? Should I not? Strong opinions.
Yeah. And the divisiveness around that and the misinformation that's kind of permeating not just our community, but every community. It's interesting where we are right now is that in many areas, we aren't sitting down and having conversations with people we know and trust. We're interacting with people electronically. And so we say things online and we dismiss people and things spread pretty wildly online. And I do think that's been it's been hard for pediatricians for sure, but I think it's hard for our kids too, because you're right. I think having clear, consistent messaging is really important. And
clear, consistent messaging that ahead of time, you have to let people know as we learn more about this particular virus from the beginning, as we gather information, guidelines are going to change. Things are, our recommendations are going to be tweaked based on what we're learning. So be ready for that, be flexible, and be patient and understanding. Yet, obviously that hasn't happened across the board, right?
It's true, and I think that's that part is pretty disheartening. I mean, listen, this is the way we learn more information. We have to adapt. We all do this every day, and in other parts of our lives. I think that's been tough. But the other piece of this too is that we know many of the things that we need to be doing to protect our community and kids, and that is everyone who's eligible to vaccinate should get a vaccine. We should be wearing masks still, even though I think many folks are kind of done with it. We should be doing things in schools, including improving ventilation, social, physical distancing, and then testing too. We've done some of these things, but you're right. For me, it's surprising as somebody in public health, as a pediatrician, it's certainly the most skepticism that me and my colleagues have ever faced when we're just trying to do our jobs, and that has been challenging.
All right, so back to the poll here, education and school quality we talk about, and that's something that I wouldn't be surprised could top the list every year. And I know it's broad, but I mean, right off the bat, this is what parents want for their kids.
We see that increasing. We see that increasing this year. I would say that the thing that we see persistently every year has been cyberbullying. Parents are very worried about cyberbullying. I think, and during the pandemic, I think that's really heightened for many of us. I have two kids. in public school, and I worry about cyberbullying. I worry about their time online, and so I think part of the message for families is know what your kids are doing online. Have like appropriate filters in your house too. There are tools that we can do that both with iPhones, with screen time, as well as other tools like Circle that you can use to both limit the amount of time that your kids get online, and all these things are tied together too. Right. We know increasingly more about things, Instagram and other things like that.
Right. Ironically, this moves up on your list and becomes a higher concern among parents because they're learning more about it, right? Like we talked about, because now we have more information about cyberbullying, how it happens. We have more examples of it with parents dealing with this. So as parents learn more, they do their research and they hear more, and especially during the pandemic, like you said, when the kids were spending a lot more time online, now it makes sense that cyberbullying is up there. So what specifically are the concerns? Is it a concern about bullying and cyberbullying at home, at school, all of the above, being a victim, their kids being a victim, or like you said, how to set filters?
Most of the parents were it was more about their kid being a victim rather than we actually did ask questions about if they found out if their kid was actually bullying somebody online. And most consistently what we see are social media platforms where that's occurring. And so I think, the message is, again, monitor those social media platforms, be careful and cautious for what your kids are talking about. And then listen, talk to your kids. I mean, part of this, a lot of the salve of this is just open, honest conversations with your kids about what's going on.
Yeah, and I think
dinner table conversations are good.
Yeah, absolutely. And even if your kid squirms a little bit or pretends like they don't want to talk about it, you still talk about it all the time, which is what I tried to do with my kids. And also at the center of this bullying, cyberbullying, we know that there's been a lot more scrutiny of some of these major social media platform companies. So it's definitely more in the spotlight about what can they do as well to help parents and help kids to avoid this.
Yeah, I think yes, I think we've seen more. We've seen congressional hearings and actions around what social media platforms are doing. I think many of us have concerns, and we see some data around social media and increased anxiety and depression, and certainly body image issues with teens. And so, I think it's something we need to be cautious about. We see a lot of issues happening on social media platform, from misinformation to issues with anxiety with kids.
All right, we want to kind of keep going down this list of top 5 concerns. This is kind of the general broad list: child mental health and suicide. And I know from just reporting the last few years, all of the studies and the data that has come out. We know, like you mentioned, the pandemic has definitely had an impact on child health, and it's not just not being in school. There's economic hardships for families, and we can't forget that obviously not being able to socialize, but a lot of kids have had to deal with death, with someone in their immediate family dying in this pandemic. So, we know there's a rise in suicide attempts among people younger than 18. What else have you learned?
Yeah, I think that was already increasing even just before the pandemic. Concerns for mental health, particularly in adolescents, that has only increased. Our polling shows higher rates of anxiety among kids. Even in 2019, we did some polling around mental health and suicide, and what we found is that a lot of parents had misconceptions about suicide. Some parents were concerned about suicide ideation in their kids, but they were afraid to talk to their kids about suicide and mental health issues. We know, for example, that if you talk to your kids about mental health, if you talk to them about suicide, it doesn't plant ideas in their head. So, having these conversations are important. And then also talking to your pediatrician, the folks that you trust and know, kind of having that relationship as a first step too, if you're having concerns about your children. Yeah, absolutely.
The issue needs to be brought out. I'm looking at, I think this was, I forget where I printed this article, but yeah, you're right, it was already increasing before the pandemic. So now you know, you can see the results of why parents are concerned, but it's a good thing that parents are ranking this very, very high, right? That this should be a priority and a concern.
Parents are concerned, kids are concerned, and I think what we need to see now is a bit more action. I mean, we see it's very difficult to get treatment, and not just in Middle Tennessee, but certainly in Middle Tennessee for kids with mental health diagnoses. We need more capacity, we need more providers. That is still a substantial issue. So yes, we're concerned about it, and being concerned is the first step. I think the next step is, what are we going to do about it to make things better? That actually, in part, goes back to schools. How can we equip schools with the right resources to be able to be kind of oftentimes at the front line of defense when we think about dealing with kids' mental health, but also, more providers in the community, things like that. And
obviously, hopefully, insurance coverage as well, more expansive insurance coverage. I'm looking at this as this one study last year found mental health related problems, sharp increase, generalized anxiety disorder, major depressive disorder, and intentional self-harm. So I understand why this ranks so high among the list. All right, when we come back, we're going to talk about numbers 4 and 5 on the general list, and then we're going to dive into masks and COVID. And yes, folks, we'd love to hear from you. 737+. How are you handling this with your kids? What are your top concerns for their overall health as we head into 2022? We'll be right back.